Hello, and welcome to the webinar COVID-19 Vaccine Information. My name is Mayra Gonzalez, and I am the Program Coordinator at Southwest Border AHEC. In this webinar, we're going to learn about the COVID-19 infection and the basics about the vaccine. We're going to learn also how to prevent this infection, some key facts about the COVID-19 vaccination, what to expect before, during, and after getting the vaccine, and where to get the vaccine. What is known about COVID-19? It is known that infection with SARS-CoV-2, the virus that causes COVID-19, can result in a range of illnesses, from mild symptoms to severe illness and death. About 30% of persons infected with SARS-CoV-2 do not have symptoms. No one can predict how severe any person's illness might be, but certain factors may increase your risk. Some people are more likely than others to become severely ill when infected, such as older adults or people with certain medical conditions like diabetes, obesity, cancer, or heart disease. There are some preventive measures that we need to take into consideration in order to prevent COVID-19. Wear a mask that covers your mouth and nose. Avoid close contact with others. Stay at least 6 feet apart from other people. Avoid crowds and poorly ventilated spaces. Wash hands often with soap and water. Use an alcohol-based hand sanitizer with at least 60% alcohol if soap and water are not available. Avoid touching your eyes, nose, and mouth with unwashed hands. Clean and disinfect frequently touched surfaces daily. And most importantly, get a COVID-19 vaccine. COVID-19 vaccination is a safer way to help build protection. Getting the virus that causes COVID-19 may offer some natural protection known as immunity. But experts don't know how long this protection lasts, and the risk of severe illness and death from COVID-19 far outweighs any benefits of natural immunity. COVID-19 vaccination will help protect you. It is easy to be confused by all the information that is circulating, some of which may be conflicting. The Centers for Disease Control and Prevention has facts to counteract common myths on this page, such as COVID-19 vaccines will not give you COVID-19. People who have gotten sick with COVID-19 may still benefit from getting vaccinated. Getting vaccinated can help prevent getting sick with COVID-19. Or COVID-19 vaccines will not cause you to test positive on COVID-19 viral tests. Something important to remember is that while COVID-19 vaccination will not cause a positive result on viral tests, there is a possibility that it could cause a positive result on a serologic test. Please visit the Centers for Disease Control and Prevention website listed here in this slide to read more about this vaccine myth and the facts about COVID-19 vaccine. COVID-19 vaccines are being held to the same safety standards as other routine vaccines. Several expert and independent groups evaluate the safety of vaccines being given to people in the United States. Before any vaccines receive authorization or approval, the Federal Drug Administration, FDA, carefully reviews all the safety data from clinical trials, and the Advisory Committee on Immunization Practices, or ACIP, which is an independent body of experts, reviews all the safety data before recommending use. The FDA and the ACIP have qualified scientific and clinical experts with minimal conflicts of interest reviewing all of the data. After any vaccines are authorized and in use, both the FDA and the CDC continue to monitor their safety. Existing systems can rapidly detect possible vaccine safety problems. These systems are being scaled up for COVID-19 vaccine introduction to fully meet the needs of the nation. Additional systems and data sources are also being developed to further enhance safety monitoring capabilities. There are systems in place that allow the CDC and the FDA to watch for safety issues. For example, the Vsaf, which is a new smartphone-based after vaccination health checker for people who receive COVID-19 vaccines. Vsaf uses text messaging and web surveys from the CDC to check in with vaccine recipients following COVID-19 vaccination. Vsaf also provides second vaccine dose reminders if needed and telephone follow-up to anyone who reports medically significant adverse events. Another system is a Vaccine Adverse Event Reporting System, which is a national system that collects reports from healthcare professionals, vaccine manufacturers, and the public of adverse events that happen after vaccination. Reports of adverse events that are unexpected, appear to happen more often than expected, or have unusual patterns are followed up with specific studies. COVID-19 vaccination will help keep you from getting COVID-19. Getting a COVID-19 vaccine will help create an immune response in your body against the virus without you having to experience illness. Based on what is known about vaccines for other diseases, experts believe that getting a COVID-19 vaccine may help keep you from getting seriously ill even if you do get COVID-19. What to expect before, during, and after COVID-19 vaccination. So before vaccination, you should learn more about the different types of COVID-19 vaccines and how they work. We have provided some of this information in this presentation. During your vaccination appointment, you should receive a paper or electronic version of a fact sheet specific to the COVID-19 vaccine you're being offered that contains information to help you understand the risks and benefits of receiving that specific vaccine. After you're vaccinated, you should be given a vaccination record card that tells you what COVID-19 vaccine you received, the date that you received it, and where you received it. Your provider may also give you information about how to enroll in Vsaf. Vsaf is a free smartphone-based tool that uses text messaging and web surveys to provide personalized health check-ins after you receive a COVID-19 vaccination. This program will help the CDC monitor safety of COVID-19 vaccines. It is important to continue using all the tools available to help stop this pandemic. Cover your mouth and nose with a mask when you're around others. Stay at least 6 feet away from others. Avoid crowds and wash your hands often. You can find more information about the Vsaf system at the website listed here in this slide. COVID-19 vaccination will be an important tool to help stop the pandemic, but it continues to be one tool in the toolbox. While COVID-19 mRNA vaccines appear to be highly effective, additional preventive tools remain important to limit the spread of COVID-19. The combination of getting vaccinated and following the CDC's recommendations to protect yourself and others will offer the best protection from COVID-19. Wash your hands, avoid close contact, cover your nose and mouth with a mask, clean and disinfect frequently touched surfaces. Stopping a pandemic requires using all the tools that we have available. It will take time to vaccinate all people living in the United States. While the vaccines are being delivered, it's important that everyone continue to take all steps to prevent the spread of COVID-19. COVID-19 vaccination can protect you, your family, your friends, and your community. Choose to get vaccinated, participate in Vsaf, and help the CDC monitor for any health effects after vaccination. Share your experience with your coworkers, friends, and family, and visibly show that you received a vaccine by wearing a sticker or a button. You have a role in increasing confidence in COVID-19 vaccination, and sharing your experience may influence those you care about. These are the websites with COVID-19 vaccine information. You can visit them to get informed about COVID vaccines and choose the one that you like. The federal government is providing the vaccine free of charge to all people living in the United States. If you have questions about your health and vaccination, call your doctor, nurse, or clinic. If you experience a fever after vaccination, you should stay home from work if you can. Most side effects after vaccination do not last very long. The vaccine does not give you COVID-19. However, you could have been exposed to the virus before you were vaccinated. So if you continue to feel sick, you should consider getting a COVID-19 test. The CDC and the FDA encourage the public to report possible side effects to the Vaccine Adverse Event Reporting System. The CDC is also implementing a new smartphone-based tool called Vsaf to check in on people's health after they have received the COVID-19 vaccine. If you enroll in Vsaf, you can tell the CDC if you have any side effects after getting a COVID-19 vaccine. If you report serious side effects, someone from the CDC will call to follow up. Thank you very much for watching this webinar. If you would like more information about the vaccine, or if you need help scheduling an appointment to get your vaccine, please contact us. My name is Mayra Gonzalez. Thank you again and have a great day.